So you're probably asking, why do I have cardiovascular problems? And I like that because now you're thinking like a medical detective and asking why before you ask for the treatment. Because you know we can't have an effective treatment if we don't know why the disease happened, right? So there are multiple causes of cardiovascular problems, and you need to find yours if you have vascular problems. This is the field of functional and integrative cardiology, and there are cardiologists who focus on this. If you have heart problems and you're taking medications for them, I highly recommend that you see a functional cardiologist to help you out. Okay, so root causes of cardiovascular conditions are really not dissimilar to those that will cause Alzheimer's. And we're talking about chronic infections, especially dental infections, uncontrolled diabetes and high blood sugar, toxic exposures, especially dental toxins, and autoimmune disease, which really is related to chronic infections and toxic exposures. So, did you know that one of the leading causes of cardiovascular disease is chronic dental infections? What? Oh, yes. There's actually a lot of published research literature linking periodontal disease to different types of heart diseases. The best known direct linkage is with individuals who get endocarditis after dental procedures. But oral infections have been linked to many other cardiovascular conditions, including atrial fibrillation, recurrent stroke, heart failure, peripheral arterial disease, and more. Okay, so let's start with periodontal disease. You see, our gum tissues are very well connected with tiny blood vessels that supply our teeth and jaw. So, with periodontal disease, pathogens like P. gingivalis can directly enter our bloodstream and stick to the inner linings of our blood vessels. When this happens, our immune cells develop antibodies to these pathogens and start attacking the inner lining of blood vessels, causing damage to them. And this leads to a cascade which involves oxidized cholesterol and ends with the formation of cardiovascular plaque. As plaque builds up, this reduces the diameter of the lumen that blood can flow through, and that causes hypertension and other cardiovascular problems. Okay, that's periodontal disease. Another huge chronic infectious culprit is gut dysbiosis. To understand how gut dysbiosis affects our heart and blood vessels, we first need to understand our body's reaction to something called lipopolysaccharide or LPS. So, bacteria are generally grouped into gram positive and gram negative species. This actually refers to how they stain when pathologists look at them under the microscope, so don't worry too much about that. But what I want you to know is that gram negative bacteria contain a lot of LPS in their cell membranes. Now, LPS is one of the things that the human body's immune system is programmed to detect and resist very strongly. An overgrowth of gut microbes typically means that you have lots of gram negative bacteria as well. And since LPS is fat soluble, when you eat a high fat meal, the LPS can dissolve in that fat and get absorbed into your bloodstream. Now you've got something in your blood that makes the immune cells go crazy because they think there's an invader. In medicine, we call this endotoxemia. So a huge inflammatory response is mounted, and this can end up causing a lot of collateral damage to your own cells, including the inner walls of your blood vessels. And again, this goes down the same road of roping in oxidized cholesterol and creating atherosclerosis or cardiovascular plaque. And we know what happens after that. Over time, the chronic inflammatory response can also result in different cardiovascular disorders, including heart attacks and heart failure. And this is the reason why, when we discussed earlier, I said that if you tested high for having gut dysbiosis, you should not start with a ketoflex diet because you could get really sick from that. Okay, so we've covered both periodontal disease and gut dysbiosis. In addition to these, do you know that other chronic infections can also contribute significantly to cardiovascular disease through the same persistent inflammatory response? And these chronic infections are the same ones that we discussed previously, including herpes viruses, Lyme disease, chlamydia, and many more. Okay, when you come back, we'll talk high blood sugar. We've already discussed the effects of high blood glucose on the system, how it coats your cells with a layer of glucose and promotes chronic inflammation in earlier modules. I want to add here that when you already have diabetes, it's quite common to have periodontal disease. This combination can really accelerate cardiovascular disease more so than just being diabetic or just having periodontal disease. So you really want to make sure that you address these. You've already learned earlier how environmental toxic substances can cause Alzheimer's. Well, these toxic substances can damage your heart and blood vessels as well, and by damaging your blood vessels, they can starve your brain of oxygen. How does the damage occur? It's because toxins can stick to the endothelial cells that line the insides of your blood vessels, and that causes your immune cells to mount an inflammatory response to them, leading to damaged blood vessels. Again, these toxins can come from the same sources that we've already talked about. Everyone may have a different set of exposures, but the number one most common ones that I've seen in my patients are dental toxins from amalgams, braces, dental implants, and other dental substances. These cause the most damage simply because they're in your mouth 24/7. And when you eat, the toxins combine with your food and get absorbed into your body. Some of the older folks have also lived in old houses with lead paint and asbestos. Also remember that our seniors are the generation that had to live through decades of lead being used in gasoline. So, with all these toxins, it's not just your blood vessels that are at risk. Your heart cells have some of the highest concentration of mitochondria in the entire body. The reason is because your heart beats nonstop 24/7. It works really hard, and so it needs to produce a lot of energy, and mitochondria are the power plants of the cells, so your heart has lots of them. Mitochondria are easily poisoned by toxic substances, and when they get hurt, your energy production goes down, and that can really hurt the heart.
This was an excerpt from our Masterclass Ending Alzheimer's with the Bredesen Protocol. If you want to learn more about how mold, heavy metals, pesticides, and chemicals can lead to Alzheimer's, how you can test if you have these, and what to do about it, you'll want to check out this masterclass at our Sophus online website. Click below to find out more.